Um, I had the stroke last July, the 17th, which really affected my vision. And I was in rehab for a couple of weeks, and they kind of worked with me on a few things with my eyes, and over time I've seen an improvement.
Yes.
Slowly, very slowly, and very gradually. I still have issues, and I have been to, just my regular medical doctors. I've been to the eye doctor, the ophthalmologist, who just was not encouraging at all. It's like I specifically asked him, what'll help? And he was like, just didn't give me any hope at all, really. Maybe. I've been to the acupuncturist. I've been in the hyperbaric chamber where they force feed you oxygen that heals your brain cells, and I just never really saw any improvement. And then I heard about you. And I've tried everything. Every time somebody's made a suggestion, I would do that. And so I came here and not knowing what to expect. And you did some eye exercises and explained to me about the pathways in the brain and all of that. And with the little eye exercises you did that day, I could see a difference, and it was just gave me hope where nothing else has, really. I mean, except, maybe it'll get better, maybe it won't. But when I come here and when I do my eye exercises, I try to do them every day and do what you tell me to do. I'm not real good about it to the extent that I probably should, but I have seen an improvement. And it gives me hope. And nothing else really has until this. And to me, I mean, when you think about it, it makes sense.
Yeah.
It just makes sense. So I'm going to keep going and hope that we just, we can max this out.
Yes, exactly. I love that. Well, and let's go ahead and chat just briefly about how I started seeing you about a month ago, and I think we've had about 4 or 5 visits. This will be our 5th visit.
Is this my 5th visit already?
Maybe so. Maybe I'm off on it.
Yeah,
4 or 5.
4 or 5.
Yeah.
Okay.
And so the first time that you came back, like the second visit, there was something, we both kind of started crying a little bit because you shared with me how significantly you felt a difference, how much of a difference it was after leaving my office. And that's something that I want to inspire other people, other practitioners, to really look into the functional aspects of it, and to realize, because I am a chiropractor that has just gone a little bit further into looking at those pathways and how that interacts with the musculoskeletal and the neurological connections.
If I mess it up, you can stop it and erase it and we'll do it over.
We love authentic, so that's okay. Yeah.
Okay.
Yes.
This is probably my 4th or 5th visit with you. And after the first visit, one of the things that I noticed driving home, one of the things I had noticed before my visit with you and before we started this treatment, was that when I was driving, there would be like to my right, if there was a fence, it appeared the fence was falling down.
Yes.
And since I've been doing these treatments, that's not happening. That fence isn't falling down. And I know we're dealing with the blind spot that I have, and apparently that's getting better because that's not showing up like it was in the very beginning, before I came here, before we started this treatment.
Yes.
So again, it's been very emotional. I know I've shed some tears here because I can see an improvement, and it gives me hope.
Yes.
And I think the positive part of that is you keep doing what you're doing and you keep trying, and that's the secret.
Yes.
Plus you're good treatment.
That's so sweet. Well, thank you. I'm so glad I get to be treating you. It is such an honor to be working with you.
Thank you.
And I know that there was one detail that we had discussed about how in the first exam even, I was performing the musculoskeletal exam and the neurological exam like we are all taught to perform, all of us practitioners, all of us chiropractors, functional neurologists, integrative neurology, anybody that goes through these fields, we learn certain exam procedures. Well, what was significant about it and what I'd like to share with my colleagues out there and then also with our patients that are potentially seeking this type of care is that even during that exam, like we were about 10 minutes into the exam and we just went a little bit further with some of those exam diagnostics, and already you had so much potential for change that you saw improvement, and you said the words, "I can see your face better," Dr. Doolittle.
When I first came in here, I mean, looking at you,
Mm-hmm.
and then you did your eye exercises and all the stuff that we did,
Mm-hmm.
and I looked up at you, and it was like I could see your face better than I could when I came in here, and that gives me tears now, because that hadn't happened before, and it happened then, and I'll keep coming back.
Oh. Well, I just hope that this inspires anyone out there that is seeking to find answers, any practitioners out there that are, struggling with like having to go through more modules, more seminars, in addition to all the education and school that you've been through for 10 years. It's a lot to ask of a practitioner to keep going and keep learning more and more. But that's what's so inspiring to me is that there can be patients that bring you so much joy and so much fulfillment. And to those patients out there, those potential patients that are seeking answers, find a functional doctor that's really wanting to help. The chiropractors are able to look on a very functional level and see areas where we might be able to help from our side of things and work in conjunction with the medical doctors. And so keep seeking these alternative forms in addition to making sure that you're dealing with your medical doctor and asking constantly everything that you're doing and confirming and also following their guidelines for health. It's just really inspiring, and we wanted to share this story, Sara and I, because we are just so thrilled about it.
She cares, and I feel that, I know that. She shows that, and that makes a big difference too.
Thank you. I do care. This is Dr. Layla Doolittle, and Sara here is here to see me, and we just wanted to share with you a little bit of our story. Thank you so much for watching.
Thank you.